With the patient seated at the edge of the table, stabilize her distal tibia using your thigh. Raise the table up while holding her leg to create a traction force at the tibio-femoral joint. Then provide mobilization in a posterior or an anterior direction to improve mobility at the knee joint as well as decrease pain. With the patient supine, have them actively flex their knee as far as they're able to tell pain. Once they feel pain, have them come out to where it is no longer painful. A belt or a gown can be placed around the distal part of the tibia to give the patient something to pull up against to add overpressure. Add a posterior glide through the tibia with your left arm to have the patient move their knee into flexion. Assess for patient's pain. If they're able to go further and have less pain, continue to add the glide and have the patient pull up with the belt into overpressure. The glide is maintained the entire time the knee is flexed and as she comes back out of it to a non-painful range. With the patient supine, a pillow or a towel roll can be placed under the knee, placing the knee in some slight flexion. Using a lubricant, place on the patient's skin as well as on your own elbow. Gently sink in to the patient's quads and lean forward. Multiple repetitions are required to improve rectus femoris mobility. To further improve knee flexion, you can have the patient place their leg off the edge of the table, allowing the knee to flex to 90 degrees, stabilize the femur and the tibia, and again, sink in with your elbow. With the patient seated at the edge of the table, have her grab her the involved leg and slowly lay back on the table. Bring the other hip into flexion and place her foot against her thigh to help maintain that position. Take the involved leg and palpate the ASIS and tack down to the table to prevent any excessive anterior pelvic tilt or lumbar extension. Bring the hip down into extension as well as bring the knee